Our team was given the challenge to address the impacts of climate change on health by reducing medical waste. This is our team.
Medical waste is a growing problem. As the health needs of the global population continue to grow, healthcare facilities are consuming more medical supplies and generating increasing amounts of medical waste worldwide. Medical waste contaminates soil and groundwater and contributes to greenhouse gas emissions through production, transportation, and incineration. The COVID-19 pandemic shed light on the dire need to improve waste management practices, expose the gaps and neglected aspects of the waste stream, including how we produce, use, and discard of our health resources.
Reducing medical waste production with innovative alternatives and improving management will reduce and mitigate the climate and health implications associated with this growing global health issue. Our team has developed 5 evidence-based recommendations to guide action and address the issues surrounding medical waste.
The healthcare sector is responsible for as much as 4.6% of total greenhouse gas emissions, one of the key contributors being transportation. Patients need to travel to medical facilities for routine checkups, consultations, and follow-up visits, leading to increased carbon emissions from vehicles. However, with the advent of telemedicine, patients can now connect with healthcare providers remotely, eliminating the need for unnecessary travel, offering convenience, accessibility, and the potential to reduce carbon emissions. Our proposal focuses on transitioning to alternative methods of healthcare delivery. However, concerted efforts from healthcare providers, policymakers, and technology developers are necessary to establish regulations to protect doctor-patient confidentiality, train medical staff, and create platforms that can be easily accessed by any sort of patients. In summary, by integrating alternative healthcare delivery, we can create a more efficient, accessible, and environmentally conscious healthcare system.
The next recommendation is transitioning to more sustainable material choices. Advancements in natural bioplastics provide a feasible replacement for traditional plastics in applications like syringes, heart pumps, and catheters. These alternatives are bio-based and biodegradable, giving circular potential in recycling management. Nitrous oxide gas, a dental anesthetic, is a potent greenhouse gas and significant contributor to global warming, and can be switched for penthorax or local nerve blocks to reduce the carbon footprint. Emerging research demonstrates the potential to harness the antimicrobial properties of zinc metal in PPE, creating self-sterilizing masks and gowns that can be safely reused.
Reprocessing has been in practice for decades, but the recent pandemic has increased consideration of reprocessing single-use medical devices that would traditionally end up in landfills after just one application. We recommend hospitals and clinics utilize in-house equipment or third-party companies for reprocessing single-use medical devices like N95 masks, fingertip oxygen sensors, and single-use surgical tools. Research shows that using reprocessed single-use devices halves greenhouse gas emissions associated with each device. Countries should also introduce legislation that ensures high-quality reprocessing techniques to protect patients, similar to current policy in countries like the US, Canada, Australia, and New Zealand. Implementing reprocessing protocols has both financial and environmental benefits that make this recommendation sustainable on several levels.
Various methods exist for treating medical waste. Incineration is most commonly used due to its success in eliminating microorganisms and reducing the quantity of waste. However, the ash produced by incineration contains toxic end products of combustion, which when landfilled contaminates the surrounding environment, whereas autoclaves are a much more environmentally friendly alternative, but are expensive for developing countries. Studies have been conducted to investigate the efficacy of heavy metal bioabsorption by fruit peels, with some peels having shown 100% efficacy under the right conditions. Using fruit peels would target SDGs 6, 7, 11, 12, and decrease the common environmental harms of medical waste treatment. Further, the Colombian Ministry of Environment and Sustainable Development states that water absorption technology could be repurposed for agricultural or industrial use. Further research is needed to explore the use of fruit peels in medical waste management.
Our fifth action is a color-coded system for waste and recycling. This begins by identifying the type of medical waste we are working with and having an estimation of the different impacts that it can have in a biological, chemical, and climate aspect. This action is based on 3 different tasks: to reinforce the measurement of the color-coded system by the promotion of good practices and correct training. We know this measurement is already being taken place worldwide, but we believe that a correct training of the healthcare system providers and the different stakeholders involved in this will achieve its maximum efficiency. As a conclusion, we hope to work with different SDGs to create sustainable changes with a long-term impact and based in an interdisciplinary team, since we believe that climate change and climate impact is a matter that must be important to all of us.